formulating research question. So what are the steps in this formulation of research question is reviewing the state of art information, like this. Review of state of art information, what does it mean? So review of state of art art information is what is already known. So go through literature review, identify gaps or conflicts in knowledge. Many studies show D-dimer helps in P diagnosis but none in pregnant women. So this is the gap, you can explore this. Then you have to raise a question. So what is the uncertainty or gap? So you have to formulate a basic question based on the what is missing or unclear. So is D-dimer a reliable test for PE in pregnancy? Third is decide if worth investigating by doing peer review and expert input. So it's important, ethical. Let us check whether it is important, ethical, feasible, relevant. You can ask experts or peers or stakeholders, is this question clinically significant? Does this passes ethical and feasibility filters? For example, there is diagnostic uncertainty in pregnancy. Yes, that's why it is worth investigating. So first, a review of state of art information, raise a question, decide worth investigating by peer review. Then you define measurable, exposable and outcomes. So what will you measure and how? So you have to define your independent variable, that is exposure, and your dependent variable, that is your outcome, and you have to ensure that they are quantifiable and valid. For example, high D-dimer level in pregnant women is the exposure, whereas outcome is the confirmed PE via imaging. Then you have to sharpen the initial question, that is you have to make the question more specific, apply finer. You have to apply this finer criteria or this PICO criteria, and you have to clarify the population, setting, time frame, etc. So for example, among pregnant women presenting with dyspnea, is D-dimer predictive of PE diagnosed on CTBA? Then you have to refine the question by specifying details. For example, you add operational definitions. So you add operational definitions. You finalize how each element is defined, measured in your study, and clarify inclusion, exclusion, test threshold. For example, you keep D-dimer cutoff greater than 500 nanograms per ml. PE confirmation, positive CTPA, you set the time frame within 48 hours of presentation. So this is how we say it. So if I will keep a mnemonic to remember, I will keep this RDMSD. R is you do a review of current knowledge, you raise a question, you decide whether it is worth investigating. You can also keep P for peer review. Then you do measurable exposures, outcomes, you define them. Then sharpen the question by doing PICO or finer criteria, you apply, and then you define your study specifics. For example, for this operational clarity. So what is this final criteria that you used in research question framing? So it's a criteria, it's used to evaluate if the research question is worth pursuing. So what is finer? F means feasible, I means interesting, it should be interesting. N means it should be novel, ethical. Last is relevant. So feasible, interesting, novel, ethical and relevant. Not reliable, it's relevant. So use finer before starting a project to avoid wasting time or effort. Another is PICO format. PICO format is used to structure a clinical question, especially in evidence-based medicine. PICO means, so what is PICO? PICO means population or patient problem. Patient or population problem. I means intervention. C means comparison. All the comparison optional here, and O is outcome. So population or patient problem, intervention, comparison, or that's an optional, and then comes this. For example, a PICO question I will tell you: in pregnant woman with suspected PE, is D-dimer testing better than clinical judgment alone at predicting pulmonary embolism confirmed on imaging? So here, for example, in this question, pregnant woman with suspected PE. So in this PICO format, P is suspected PE. In suspected PE is D-dimer. We are doing a comparison. It is comparison is here. So we are doing a comparison between whether D-dimer testing or your clinical judgment. So there is this comparison. Okay, but D-dimer here is also an intervention. When P was suspected, this patient or this was a problem. You suspect P, that is the patient or population problem. That is, this is P here, and this is suspected PE. So in suspected PE, suspected PE becomes P, that is patient problem or population problem. This D-dimer is an intervention, but this is clinical judgment. This is clinical judgment, so this becomes a comparison, and final is outcome is predicting PE on imaging. So imaging here is O. So this is PICO format.